Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Srimati Jayalakshmi H.K. She is a child prodigy, started singing at the age of 3 years, and then she was recognized as the multifaceted child by UNESCO. She is the first woman in Karnataka, a scientist who worked on the food science as well as the nutrition. As a musician, she worked on the music therapy as per the Samaveda. Known as a walking encyclopedia, and she is the founder director of Prajnanam Vedic Research Institute. Welcome, Vijayalakshmi. It's a pleasure to have you on our show. You know, nowadays we see the people with the bipolar disorder, with the mood fluctuation. Sometimes they are very high, sometimes very low, and they are not normal. And when they are high, they listen to this DJ music, high decibel music, loud music, and then they invite the ill health. Because we know that the high decibel music can have the hammer their brain, and then the electromagnetic waves that are sent, the heart fibrillation can occur, and they can have a ventricular fibrillation and the cardiac arrest. But when they're low, they get disgusted with the music. They feel that it is not good. So they're averse to the music. They're not listening. But our Indians scientific music, what we call Shastriya Sangeeta, it has got the special ragas for these mood fluctuations and the changes in the brain and the chemicals like serotonin and other things. So please tell us, in this bipolar disorder or the mania, apart from the treatment from the psychiatrist, what the music therapy can add on and how they can lead a better life. Please tell us.
Definitely, ma'am. It's such a privilege to speak on mania in terms of treatment, that too through music therapy on Samaveda base. And it's such a privilege to be interviewed by your kind souls. And I'm going to share my experiences and to the extent the scientific authentication behind music therapy. See, mania or udreka or bipolar, whatever we claim, see, here in this lane of disorder, mental disability disorder, see, we do find the patient or the person have the flux, extreme flux in his mood trends.
Yes.
Sometimes he'll be very calm, very appear to be very balanced, and sometimes it is his emotional interpretation will be heightened to the extent of psychosis, where he can't be controlled due to the flux in secretion of serotonin and also the impaired secretion of GABA. Hence, our aim in terms of music therapy is to calm down and to work upon the neuroplasticity, which can be formulated, can be emerged in the brain through a particular node as it stimulate in a positive way to that particular brain center because of its frequency and resonative energy. See, there is a particular set lane of notes and ragas in our music, Carnatic classical music, of course, in Hindustani. So, where the patient can be made to listen or to repeat the notes. If at all he is cooperative, he can sing through active mode. We can also make him to repeat the notes or any song which is formulated in a very, very simple manner, though not in a classical manner. Because I can sing, because I'm a classical vocal musician, vocalist, Carnatic classical music, but everyone can't sing.
Yes.
So we can make them to listen, that is passive mode. If at all they can repeat the notes or the words or whatever which is being set in a particular raga, they can repeat it. Particularly for this, to keep his serotonin levels under control in a balanced manner, it is the node that is Sa, sa re ga ma pa dha ni sa ni da pa ga re sa sa. Particularly with this plane of scale, sa re ga ma pa dha ni sa ni da pa ga re sa sa. In Carnatic classical music, this is called as 15th. This raga is 15th Melkarta raga. That is, this raga's name is Maya Malava Gaula, where this raga is used as the base raga to start up uh, the lessons of Carnatic classical music for a beginner. This is the raga which is used because it is easy for a person to pick the notes and to keep his vocal cords set to go to the higher version of lessons, so that he can receive the higher version of lessons with this base level of trainings. This raga is Maya Malava Gaula. This raga to be heard before 9 a.m., where in the cosmos, in the universe, which is directly in correlation with human body composition, which is made up of Pancha Mahabhutas, 5 elements, Agni, Vayu, Prithvi, Jala, and Akasham. During morning session, it is all earth. So even in the universe, cosmos, it is also earth. This Shadja, so the resonative energy which emerges from this node will be stimulating positively, that is called as Uttejanam, to that particular neurocenter of the brain to release serotonin and also the GABA-laden chemicals in a balanced manner. So this particular note, Shadja, sa, sa ri ga ma pa da ni sa, sa ri ga ma pa da ni sa, sa ni da pa da pa ma ga ri sa sa. We have seen in the movie Shankarabharanam when I was maybe 7 years old, I suppose. I saw that movie 7 or 10 years old, I suppose. Sa re ga pa na pa ma ga re. See, during morning session, they used to sing those raga which is predominated by Shadja, like Bhauli, Purvi, Chakravaka, Maya Malava Gavla. These ragas are predominated with earth element. That's why we sing all these ragas before 9 a.m., particularly during Brahmi Muhurta. That's why in the morning, we sing, we practice Sarale Varse, which are all the basic lessons of Carnatic classical music in Maya Malava Gaula raga only, not in other ragas. Because it is easy for a sadhaka, for a child, or maybe whoever learns, easy to pick up. Because early morning it is earth fluxing time, and also this particular raga also interprets the earth element, that is Prithvi Tattvam. This raga should not be sung in the evening, because in the evening again it is Vayu fluxing. We have to go for Hindol. Sagamadani sani magasaza gamagasaza ni zagazaza ni zagagasaza sani magasaza. Maybe Jayanta Shri. Sagamadani sani magasaza marugelera o Raghava అన్ని నీవనుచు అంతరంగమున తినగా వెగతి తెలుసుకొంటినయ్యా నిన్నెగాని వదిలేనెన్న జాగనురులా నన్ను బ్రోవయ్యా త్యాగరాజనుత మరుగేలరా ఓ రాఘవా. Even this Hindol, if at all, if they have any psychosis type of trends in the evenings, they can listen to raga, even Hindol also. But in the morning, the treatment regime is Maya Malava Gauda. Sare ga ma pa da ni sa Maya Malava Gauda. Purvi Purab se Surya Jaga or Sare ga ma pa da ni sa ni ra ga ri sa Chakravaka. This is called as Ahir Bhairav. Otherwise, just make that patient to repeat the note sa with Shunya Mudra. See, with Shunya Mudra, his thought process will be arrested. Maybe he will not go with the racing thoughts.
That hyperactivity will come down.
Will come down. So that is the power of Shunya Mudra. And also sometimes Vajra Mudra, because Vajra Mudra gives the clarity of thought. And it improvises the circulation. Because why that flux in secretion of serotonin and GABA? Because that Vyanavata inside human body, or the whatever the way we claim in terms of modern medical science, that circulation prakriya will be disturbed with manic patients. So this Vajra Mudra will improvise, and also Prana Mudra will improvise. So that these mudras to be taken up in the morning, not in the evening. Because if you improvise your circulation in the evening, you don't get sleep. So evening you can give Vajra Mudra, Shunya Mudra or Apana Mudra, like that. Even Mudra regimes with this music and with a particular note, and also particular dietary habits, and with this allopathical, if the need be, maybe Ayurveda, any treatment regimes can be
along with the medicine and the counseling and everything. They can also have additional music therapy and the mudra.
Definitely,
and that will be beneficial to them. And thank you very much, Jayalakshmi, for explaining so beautifully, so clearly, and what it has to be done. So people, whenever they are hyperactive or depressed, better to go for the music therapy. Thank you very much.
Thank you, ma'am. It's such a blessing to interpret this science at my knowledge level, at my experience level. Thank you for this opportunity. My humble pranams to you. Namaskaram.
Namaskar.